couldn't
I'll
find it.
tell you.
Yeah,
I'll tell you what the connection is.
All right, I'm ready if you're ready.
Ready to go.
Here we go. You're listening to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture On Air program. Our pleasure, as always, to have in the studio and live to air almost on YouTube. Say good day to all your buddies.
Yep. Hello out there. How's everyone out there in YouTube land?
They are all very well. I'm listening to you, Heiko. Anyway, you're Heiko from the Acupuncture Clinic in Hastings. Just remind our listeners and viewers where you are.
I'm in 206 Charles Street, Hastings. Have a look at my website. It's acu123.co.nz.
Is growing your industry, I mean, before we get to today's subject, but is acupuncture growing in popularity? Are you finding that more and more?
Well, I can say, look, when I was first came to New Zealand, our Acupuncture Association, I was member 97 or member 96 or something.
Yep.
And now we have over 700.
Wow.
And that's growing very fast. And when I was here in that year 99, there was one very small college in Wellington, and then they've now really expanded large in size and have another sister college in Auckland. Mm-hmm. So there's 3 times as many people graduating. In addition to that, there's more people migrating to Australia and our membership, as well as Chinese people coming. We have English people, Americans, even people like me, Australians, even they're allowed in here. It's quite a growing, profession.
I suppose if there was a downside to what you do is that anyone can hang up a shingle, but you're qualified, you're certificated, you're the real deal, aren't you?
Yeah, well, that's why I think if you want to see someone in New Zealand, and there's an acupuncture called Acupuncture New Zealand.
Yeah.
I mean, if you basically type in Acupuncture New Zealand to Google, you'll get to their website, or you can contact me through the radio station if you're looking for someone specifically, maybe in your hometown in Gore or somewhere. I might be able to find someone there for you. And all these people who are in the association have basically done the equivalent, or have done a Bachelor of Acupuncture 4 years full-time training. So we know that, they're qualified, they've been assessed, and they do ongoing continuing education. They have, regular audits per se. But unfortunately, there are people out there who just call themselves acupuncturists and have had no training or training of a dubious quality, and I have to say that's where when registration does come through, these type of people will be weeded out.
Yeah. How do they know that you're registered? You've got a big sign that's there's a neon sign in your room going bang, bang, bang.
No, to be honest, no, not really. It's just that, to be able to do it with ACC, you need to be registered. And usually that's one of the first signs. If you can ask them, are you registered to do acupuncture? And they'll say, oh, no. Then you go, well, then the reason is because the qualification is not to that standard.
Right. Today we're going to talk about a subject which you and I don't know anything about, period pain.
But we've heard about it.
We've heard about it, right.
At one stage we did have on the show a acupuncturist from Auckland, Micah Moore, who was doing a PhD in dysmenorrhea, or what's called menstrual pain, or period pain, and he's now continuing his research in Australia, and and has demonstrated through the various research programs what he's done, the efficacy of doing acupuncture for period pain.
Yeah, is it common, period pain?
Yeah, well, I know it's common because many of my women will have it either severely or moderately or sometimes. But I had a quick look on the internet just, and again their stat is quite vague, and they say something like 20 to 90% of women will have it.
Variance.
So but again, I think that's sort of broad spectrum statistics sort of says that might be, some women have it sometimes, and the pain might be 3 out of 10 or something. So it may be mild, and then others is more severe. But I think it does so to say that at some time in the life of women, that they will have some kind of problem.
Yeah, and I suppose it's a little bit like migraines, that some people get a migraine, then come to work. Some people get a migraine, they've got to stay home for a few days. It will be the same with period pain, would it?
Yeah, and it's, I mean, I do have female patients where they've come and they say it's so severe that they'll have to take a day off work, and others will say when it gets so severe that they take really strong medication, and then that stops their thinking ability, and it may end up giving them stomach problems if they're on anti-inflammatory type pills. So yeah, there is a big range, and some women have just unfortunately have had it, all their life, and never sort of realise that there maybe is an alternative to helping them.
So what are some of the symptoms of period pain?
Well, again, obviously it's the pain, and it's usually a lower down type pain. It's not like in the stomach, but it's in the lower abdomen, and also what's called like the pelvic area, or the around sort of the groin area. But in addition to that, you can also get back pain, and sometimes it's quite common after the menstrual cycle they'll have back pain. And these sort of specific little signs in terms of Chinese medicine indicate a different type of sort of diagnosis depending when the pain is, where it is. Some will get it before the cycle, some get it during the cycle. There are other signs associated with the problem, and that can be stuff like mood swings. They can be more irritable, they can be teary, they can be sad, they can just be feeling flat, unmotivated, sore breasts, nausea, vomiting, nosebleeds. I mean, there's many different types of symptoms associated, and you probably heard they talk about PMS, premenstrual syndrome. There's a whole host of different types of symptoms that you can get with that, and the period pain is a common one associated with that.
Now, all of those symptoms that you mentioned, of course, no two people are probably the same.
And that's it. And in terms of Chinese medicine, that's always the case. And this is where in Western medicine, it's we try to find one drug that fits all. And whereas I'll have a patient say, "Oh, look, I just want a herb to treat the period pain. I want to replace my anti-inflammatory with herb X." And I said, look, I just can't do that. It's sort of like I need to know, what this, are you patient A, B, C, D, E, F, G, or H? And they all have different types of personality, symptoms, age, is the cycle late? Is it early? Is it on time? And there's many, many different variables that come in. And so then you tailor-make a treatment to treat that person's imbalance.
So yours is a holistic treatment as opposed to going to the doctor who will either prescribe a painkiller or a hormone treatment.
And again, this tends to be the only really sort of two options. I mean, there are other causes of period pain that, which we have also spoken about on this show before, endometriosis and fibroids. But unfortunately, these conditions usually end up going down the track for some kind of surgery. Be it that they can also be treated with acupuncture, but acupuncture is getting to the root cause of why the fibroids got there in the first place, or why there is an endometriosis pattern in that person.
So I suppose if you've got those things, is surgery the answer?
As I said, that's usually what happens. It's not necessarily the best answer, because often what you find is that the fibroids then can come back.
Yeah.
And often they've had treatment for endometriosis, but then they still have the period pain. So it's not always as simple and as clear cut as that. Of course, there are dramatic, successful cases as well, but there's also many cases where it hasn't actually helped.
Why is there pain associated with the menstrual cycle?
In terms of Chinese medicine, any type of pain, we have a very simple saying: where there's blockage, there's pain, and you have the energy that moves through the meridians, moves through the channels. If that gets blocked for some reason, then you have pain. In terms of the female and the gynecology, the liver and the spleen are very big, important organs. Those meridians, they travel up on the inside of the leg. They go through the groin, through the genitals, through the lower abdomen, up to the breast. And so if that's blocked for whatever reason, whether it's emotionally caused or dietary or work or lifestyle or come about from another illness, once that blockage is there in that meridian, then you get pain. So the concept of the treatment is basically, we say, the free flow, the course of energy through the meridian. When we do that, then there's pain. But that actually gets to the root cause of the problem so that the period pain doesn't come back. Whereas, the Western medical approach is, well, you wait another month, get the period pain, and then take an anti-inflammatory.
Yeah. You mentioned the liver. Now, a couple of weeks back, we did a program on the liver, and I don't remember you mentioning period pain then. Did you do it?
To be honest, I can't remember either. I know that we did the show on the liver, because I said that the liver it treats many things, always responsible for many symptoms and conditions. But if we think about the liver in real simple terms, it's basically like a big sponge full of blood, and the menstrual cycle is relates to the blood. And so often if the blood is not flowing properly or smoothly, then the mechanism or the underlying pathology comes from the liver. And so, as we said, we would use liver points.
Yes, of course.
And if you can have a look at some of the old classic indications for some of those liver points in the lower leg, on the feet, you will see, treats menstrual pain, treats pain in the lower abdomen. Because if we can get that energy moving through there, then the pain stops, because indirectly or directly, it's helping the blood flow from the liver generally.
Yeah. Okay, so we're going to treat it with, obviously, with the needle, but a lot of people, like I've mentioned to you many times, a lot of people like to put something in their mouth.
Yep.
So what about the herbs for it?
Yeah, again, there are many herbs and herb formulas that treat a whole host of different women's gynecology problems. Commonly, though, the liver and / the spleen disharmony is probably the most common one. And so we have many different type of herb formulas that address the one is for, say, movement of blood. And a common herb now that more people are getting aware of is a herb called dongui or angelica root, which you can sort of buy as little pills in the health food store. That's more of a tonic for the blood. But if you can help for the, we say, the deficiency, which is another cause of menstrual pain. And what you find with these women, when they get their period pain, they want to press on their stomach and, that feels better.
Want a bit of massage.
Right. Because it's deficient, it's weak, it's empty. When you're pressing on it, you're actually supplying energy, life force. And then those type of cases that you do respond better for like what we call a tonic approach, such as with the angelica root and the dongui. However, if you press on your stomach and it feels worse, then as we say, it's an excess condition. There's too much stuff stuck there. You don't want to be adding things.
Yeah.
And then we use herbs that have a different property. Those herbs, they move the energy. They circulate the energy. Say buplurum is another example for that one.
We often talk about hot and cold, and I see in your notes, I've had a bit of your notes that you sent through, and you mentioned cold, people swimming in cold water, eating too much cold food. So moxibustion must be good for it. Yeah,
and this is interesting, if I can relay that across to the audience, just the different concept between the Western approach and then the Chinese Eastern approach. Chinese women, when they're having their period, and I know that because we've spoken to the teachers at Havelock High, and they have a number of Chinese Asian girls there. They won't go swimming if they're having their period. And they say, well, what is that? So, well, that's because it's like the wetness, the coldness of the water penetrates, we say, the body during a vulnerable, weakened state, and then can cause stagnation of cold and so forth. So they don't do that. And, like they won't eat like ice cream during they're having their period. They won't have ice drinks. They go, oh, no, not during that because I'm vulnerable, then I'm weak. And I know that we have a Chinese homestay student staying with us, and if she's having the cycle, My wife will cook some extra special things for her. You know, it might be a little bit of a lamb cooked with onion and ginger for warming up. Whereas the Western approach is, we're always the same. You know,
that's right.
We can do a triathlon and go swimming in ice. That's all okay.
Yes.
It is okay for business for us because they're actually causing it. And what you find with these women who have this, what we call cold accumulation, they'll actually say, when I get the period pain, the only thing that seems to help is a hot water bottle, right? And that really just confirms the diagnosis.
Proof of the pudding.
So we use moxibustion, and I often note for that, we'll put in a hot, but there's inflammation, that's hot. I said, no, the problem's cold.
Yeah,
right?
Indeed.
Moxa, warmth, ginger soup, you know, and it improves.
Black, white, yin, yang.
That's right, yeah. And you're quite yin yang today, actually, with your black and white shirt there.
Sort of like my Goodfellas shirt.
Yeah.
So I could be in the Italian mafia or something.
Yeah.
Anyway, before we get to our weird song, just remind our listeners where you are.
You're 206 Charles Street, the Acupuncture Clinic, and also my friend John Kennedy has a clinic down in Masterton, 49 Church Street. And the closing with the show today, we're going to be... you probably would have heard of John Mayall.
I've heard of John Mayall and the
Blues Breakers.
That's right.
And then his album Turning Point, right? And then there's it's many good songs in there, but one of them is called Room to Move, which is what we listen. And the reason that I actually picked, just because I like the album and I like the song, so I did that. And then I just did a bit of reading about it, and then I realised that the guitarist on there, John Mark, he actually ended up moving. Now he lives in Rotorua.
Does he really?
Yeah.
Sort of come to good old NZ.
Yeah, he's come to New Zealand.
Come to live in paradise.
And his music style, he kept recording and doing many things. And I think as he matured, he's doing a lot more like ambient meditation type music, which I never realised. So I'm going to, that's my next little project to find out
some of his music.
Some of that.
Add to your weird collection.
And then I thought we've got to track him down and get him on the show.
You should do that. Yeah. Why don't you?
Well, I will.
Yeah,
so there.
Good on you, Heiko. As always, a pleasure. You look after yourself. We'll talk to same time, same place next week.
Okay, all the best. Cheers.